Department. This evening, this community meeting came about at a suggestion of Chief Dustin Bossinger. Chief Bossinger realized that we're having an issue with heroin in our community in southwest North Dakota and asked that we get our professionals together. We have 3 speakers this evening. We'll start out with Chief Bossinger, Dr. David Kylan, and then Jan Kuhn, the licensed addiction counselor. So with no further ado, Chief Bossinger.
Well, thank you guys for coming. I think there's kind of a misconception out there since the oil boom is the peak of the activity is down, that we're no longer busy. The activity has decreased. You can ask Dr. Kylan what he's seen in the ER, but I'm sure his workload has not decreased that much. You can ask addiction counselor Jan Kuhn how much her workload has decreased. I'm sure she's going to say the same thing. It has not decreased that much. Has our call volume gone down? We have seen a decrease in call volume. Still, our serious nature of our crimes that we're seeing, the assaults, the aggravated assaults, the weapon-related calls, the drug-related calls, they still remain quite fluent. And those are our most risky calls that we see. Our domestic violence calls are also up. We still see a lot of that. A couple of weeks ago, or about a month ago, we've seen a huge increase in the number of overdoses that we were seeing. It was very alarming for our community to see that, particularly with the heroin usage. The last couple of years, we haven't seen a lot of heroin on our streets. That's no longer the case. Even the so-called sleepy streets of Dickinson, North Dakota, we have a lot of heroin on our streets, and it's affecting our community quite rapidly. That's why we started putting this program together, and I asked Sergeant Wallace to put it together. Sergeant Wallace just did a stint with the Drug Task Force, so he has a lot of direct, hands-on knowledge of what he's seen as being part of the Drug Task Force. So we're going to ask him for some comments as well later. You'll see later in the slideshow. How I'm going to start out, I got about 15 basic slides to kind of lay the premise down. Then we're going to kind of see what the emergency room doctor and Dr. Kylan has seen in the ER, and also is what the addiction counselor services seen as well with that. So we'll get started. Cost to the community. The cost to the community goes much further than just economic cost. Heroin is a substance that can rip a community apart. 1 in 4 people that use heroin has a chance of overdosing and dying. So if you're a first-time user on heroin, you might as well be playing Russian roulette. The cost of investigating drug cases, Dickinson PD, Southwest Drug Task Force, a lot of time is spent trying to catch the bad guys, the drug dealers. There's a lot of money spent on that, a lot of man hours. Also ties up the court system. Prosecution of drug cases, oftentimes it's very difficult. There's a lot of time spent in tracking down a drug case, especially if you try to track down a major dealer in our area. You may see right now, there's a lot of thefts occurring in our community. People that have drug addiction, particularly heroin, oftentimes they're not able to hold a job down. Their addiction is costing them a lot of money to maintain their habit. So a lot of times they got to support that habit. Stealing property, pawning that off, that is one way that they can support their habits. Loss of work time is definitely an issue. Medical response to overdose cases. How much time is the Dickinson Ambulance Service responding to drug overdoses? How much time is a drug overdose tying up an important time in the emergency room? Medical treatment for overdose victims. Additional treatment for heroin addicts. And also, what does it cost a family? If a family has a family member that you're trying to deal with an addiction issue can rip a family apart. Kind of some of the results of heroin usage in our community recently. Within the last 2 years, there's been 4 confirmed deaths in Dickinson from heroin usage. In the last 2 years, there's been 11 overdoses. And in 1 week's period of time, we've had 4 heroin overdoses. What is heroin? Heroin comes from poppies. Harvesters cut the pod and juice seeps out. The sap has a high content of morphine, which creates heroin. The most common areas where poppy is grown is in Afghanistan. How is heroin used? It can be smoked, injected, snorted, ingested, or sniffed. Any method will create an addiction problem, no matter how you use it. Why do people use heroin? Oftentimes, people need another high to turn to after running out of prescription painkillers such as Vicodin and oxycodone. It felt so good, but this is only the first time. After that, there's no first time with heroin. You use it once, you're addicted. And sometimes there's genetic vulnerability, addiction in the family. Sometimes there's basically a lack of knowledge. They think it's no big deal to use heroin. The use of other drugs, maybe they start out using marijuana. You know, oftentimes you hear people say that marijuana is a gateway to other drugs. They start out small, and it leads up to more hard drugs such as heroin. Oftentimes it can be cheaper than cigarettes and prescription painkillers. That might not be the case in southwestern North Dakota, and Sergeant Wallace will touch on that. Increased purity. You know, in 2010, it used to be 35% pure, compared to 4% in the 1980s. This allows users to snort or smoke it, which is less scary than injecting. And I think Jan is going to touch on just some of the purity issues that she's seen with some of the people that she's providing addiction services for. Some of the slang names on the street: brown sugar, horse, black tar, junk, big H, dope, muck, smack. Those are some of the slang names for heroin on our streets. Some basic statistics. According to the Center for Disease Control, in a report released in July of 2015, there has been a 63% increase in the use of heroin from 2002 to 2013. Why do you guys think that is? Kind of interested. What is your guys' opinion? Any guesses? Dave, what do you think would be one?
Painkillers.
Painkillers, right. How many people in our society do you think are addicted to painkillers? A lot. Dr. Kylan, how many people come to the ER in search of painkillers? Exactly. Maybe it starts out as they have a medical problem, they get hooked on it, or maybe they're just looking for that fix. Using prescription painkillers like Vicodin and oxycodone, it can lead to addiction. When the pills run out, the person may turn to stealing pills from family members. Then they may turn to buying heroin because it's cheaper for the beginning user, the black market painkillers. Heroin is one of the most addictive substances on the planet. It is more addictive than tobacco, cocaine, and most other drugs. I'm going to turn this over to Sergeant Wallace. Like I said, Sergeant Wallace spent several months attached to our local drug task force, and he's seen kind of the damage of heroin and some of the heroin contacts on the street for firsthand. So I'm going to have him provide some comment.
Just regarding this slide, from the Southwest Narcotics Task Force, what happened is we had not seen heroin for the longest time. And then we had an overdose in particular at a residence, and right after that, we started hearing about something called China White. And this stuff was supposed to be more potent than black tar heroin. Through informant, we were able to actually find the gentleman who was selling that in Dickinson, made an arrest on that person. This China White was so potent, they were selling it for $700 a gram. And they sell it by points. So a point would be a quarter of a gram. This gentleman was selling it at $700. Black tar heroin was selling for $300 to $400 a gram. In particular, we got involved in a case with the Dickinson Police Department, parole and probation. We raided a house, and in that particular house, the gentleman kept a very distinct ledger. His distributor came up out of Denver. They were running through on a very limited client base because people who are hooked on heroin have to come back to that addiction, have to keep coming back. They had a very limited client base, and they were turning over $20,000 a month through one house. Realizing we have a serious problem, as they come out in the past, in particular Grand Forks started talking about heroin now being laced with fentanyl, one of the most powerful painkillers out there. So now we're starting to see the overdoses here, and we're starting to see the deaths. And is now rising up in charge of one of the items that we, the drug task force, return to target.
As Dave had commented, the client base for the sale of heroin was very limited, thus avoiding detection for law enforcement. The heroin dealers in our area are very smart. They keep their client base very small. They know that they don't have to have a very big client base because it's very addictive. They get them hooked, and they can generate a lot of cash that way. Information reviewed regarding the sale of heroin showed that customers were begging for the drug as their withdrawal symptoms increased. Customers were mostly on a cash-only basis. If customers did not have cash, the dealers would often trade stolen property for heroin, thus increase in thefts in our community. This past week, officers encountered a heroin addict. The addict reported that his withdrawal symptoms started at, if he didn't inject himself or utilize heroin every 4 hours, he was affected by withdrawal symptoms. Do you imagine how that individual can function, nonetheless pay for a habit that he'd have to utilize heroin every 4 hours? How can I tell if a friend is using? Major changes in the attitude, behavior. He's moody, angry. Oftentimes catch that individual lying. He may be ditching school, missing in action, might not be showing up for work, might not be showing up for school. Dark pupils might be falling asleep in school, class, or at work. Oftentimes he might be stealing, pawning off personal items. Maybe you might notice that he's pawning off his computer, iPod, other items. He's getting rid of personal property to support his habit. Some signs of heroin overdose, which Dr. Kylan will be touching on here shortly. I'm just going to kind of give a brief overview. Slow breathing, blue lips and fingernails, cold, clammy skin, shaking. So what should one do? If you're at a party and you think somebody's overdosing on heroin, call 911 immediately. Get medical attention for them. Okay, what we'll do is we're going to do a kind of a question and answer thing at the end, but right now I'm going to turn it over to Dr. Kylan.
Hi, I'm Dr. Kylan. I work here at St. Joe's ER. I went to school at UND, did my residency in emergency medicine in Saginaw, Michigan, which was north of Detroit, about 60 miles, so we saw some of that Detroit drug traffic at time. I came to work here about 8 years ago, and that 8 or 9 years ago, about that time, it seemed like there was a lot of meth at that time, and that kind of went down a little bit, and then, like in the last year or two, we've seen more heroin, more overdose, more people addicted to that, and the meth, started coming back too. But it's some of the things you'll see with that, like these people will be trying to get drugs all the time. We see, and I may have over-exaggerated 50%, but it's less than that. But it seems like at times these people are coming in, and I feel sorry for if you come in and you truly have back pain, dental pain, or some other kind of pain issue, because we're always like, can we believe these guys? Because it's hard to prove you have back pain. It's hard to prove that you have dental pain unless you have your jaw swollen. But those are things they may come into to try to get those medications to help, get that high. So we're always looking at that, and you're always, can I believe this person or not? Because you see that all the time. And what North Dakota is good about the pharmacies, like if they know this person has gotten like 3 or 4 prescriptions from somebody else, they'll call us and let us know. He just got, 90 Percocet like 3 days ago. Do you want us to fill this script? And they're like, no, don't do that. And then also, the state board of pharmacy keeps track of who's getting these prescriptions, and like once a month, once every other month, we'll get a printout of anybody that is going to multiple pharmacies or getting multiple providers to give them prescriptions, and you're like, oh, I got they lied to me again, or I got, snowballed. So you remember that name, and try not to give them something else to help with the pain. But we've been seeing these overdoses. There have been a few deaths with them. Some of the symptoms you're going to see with this, the pinpoint pupils, because what happens is the opiates constrict their pupils, so they look like pinpoint. And but that's not always the case with heroin, morphine, any of those, because they will take other things when they're doing the drugs. So it can be even normal size, normal dilation, or there's some narcotics that will not dilate the pupils as much. But the big thing is the respiratory depression when they're breathing less than like 12 a minute. That's not good, or even less, or they're turning blue, not responding to you. Those are the big things. That's what you need to stop and reverse, is that respiratory depression, because that's what they die from, is when they stop breathing, or they're breathing so slow that they can't keep up with it. That's the big thing. They can have low blood pressure, things like that, kind of out of it. And those are the big things, but the big thing is the respiratory depression. That's what they die from. And the reversal agent for that is Narcan or naloxone. We'll give it in 2 milligrams usually, and it's best to inject it. They even have auto injectors like EpiPens now that they make that you can get. And there are some states that have programs where drug abusers or people like that can get these through different programs. We don't have that here, obviously. But there are those auto injectors, or if you have somebody that's got chronic pain, cancer, those kind of things, and they are getting a lot of those pain meds, sometimes you can have that Narcan available if they get that overdose. But that's out there for the market, and they do try to get those people. Will try to dupe you into getting them some Narcan, which I've never prescribed it ever, but you can prescribe that to help with the overdose. So that's the big thing, is if you give them the Narcan, they come in, they're unresponsive, they're not breathing very well, pinpoint pupils. We give them the Narcan, either give them a shot, start an IV. If you're not able to get them back, and we secure their airway, we have to ventilate them, start breathing for them, and that will hopefully help while that Narcan's working. And you got to be careful, the Narcan doesn't last that long, and some of these opiates last longer than the Narcan. So they could be at a party and someone that has one of those auto injectors, they give it to him, he's out partying, an hour later he could drop again and stop breathing again, because those drugs last longer. We've had to have people on Narcan drips, where we put some in an IV bag and we just give them so much every hour, over the whole night, while they're coming off of these narcotics, maintaining the airway. And I'd have to say that one of the worst cases I saw when I was here, we got called, 2 people coming in, not responding. So we're getting ready. We had both trauma bays ready. One of them came in first. He was really sick. We couldn't revive him. The other one gave him the Narcan, the EMS, the ambulance did en route. He came back, was breathing fine. We had to keep giving him the Narcan. But they thought they were buying cocaine, and it ended up being the China White and the heroin. So they were having a good time, and here they died because they bought the wrong drugs. They looked similar. The dealer gave them the wrong medicine, or he gave them the right one, I don't know. But that was probably the worst case. Young men, one feels really guilty because the other guy died, and the other guy ended his life. And that's the other thing, these people, I know they trust these people. Like when I was doing a residency in Saginaw, Michigan, north of Detroit, we had there was a gang or supplier in Detroit that was mixing fentanyl with heroin, and fentanyl is about 100 times more potent than morphine or heroin, and then like Dilaudid is 10 times, but fentanyl's like 100 times more potent. They were putting the fentanyl, mixing it in with the heroin, and they had a bunch of deaths around the Detroit area, and you could see how the drugs were disseminated through Michigan. Within 2 weeks, we had we continue to have more deaths from overdoses from this drug being disseminated up, because that fentanyl is very potent. It's like 100 times more potent. That is something that's only IV or IM. That I don't know how they're getting this stuff. I really don't. And then there's other things that they'll mix with this heroin. I think now there's been some cases in Russia where they were mixing some caustic agents into the heroin so that there's more of it. And it's called crocodilla or something like that, and they would inject it, and it would that caustic substance would just pretty much eat their arm. Like they'd be losing chunks of skin off their arm from the injection. So you don't know what these guys are putting in this stuff, and they're still buying it and the overdose. So it's a big problem. I think this is needed to get the people aware of what's going on out there. Any questions at all?
We're going to come back to your document in just a few minutes.
All right.
That, Jan Kuhn.
Hi. First of all, I'd like to thank the Dickinson Police Department for asking me to talk about this. Addictions are my life, so I'm very humbled that you would ask me. Thank you. I don't know if I'm going to be preaching to the choir or not. I see several professionals, Darianne from the domestic violence, Sandy Thompson from Badlands Human Service Center. By show of hands, how many of you have anyone that you know or love that you might suspect is using heroin or opiates? You, sir? Is that you? Okay. Is there anyone that is here that? Oh, Jennifer. Jennifer too. Okay. Is there anybody here that has anyone that they know or love that's gone on heroin or opiates? You don't know what to do anymore. Some people. Okay. There's two different ways to approach this depending on where they are in their use. So I also am on call at St. Joseph's Hospital 24/7. So they do call me on different patients, and they're looking for. They call me for two reasons, and that is if the person has to have their use is so concerning that they have to have a safe discharge. Or their use is so concerning and actually endangering themselves or others, and it's an emergent, so that they're looking for commitment for that person. So our treatment that's available here in the Dickinson area is not as comprehensive as it should be at this point. You know, we're short on addiction staff. We're short. Oh. Okay, all right. They're short on addiction staff, we're short on treatment centers. And when you get into heroin use, what you really need as well is a detox center. Because if you have a person who is using, before they can even successfully think about going into a program, they need to be detoxed. It would be nice if they'd be fully detoxed, but so many times we're putting them into treatment when they're not fully detoxed. So, how do you know if somebody you love is using? I've had so many teenagers that their parents they think they're paying attention, but they're really not. They're coming home late at night. They tell their parents, oh, they're so tired, you know, they have to go to bed. Parents, good, wonderful parents, are not catching it. And they just get very, very good at hiding the fact that they're using. That's on that scale. When you get to the point where they're now rigging up, that we call it rigging up, injecting, the fact of the matter is, and it's a rough fact, from my experience, relating to that person anymore who is a member of your family that you know and love cannot really happen that way anymore. They're playing hardball out in the street. They're streetwise, they know what they're doing, and the boy next door who used to be smoking a little weed is now very sophisticatedly hooked up to, I mean, the networks are completely professional and sophisticated. They're using the good stuff. They're not using some kind of whatever, no. The people in Dickinson are using the good stuff. So what do you do in that case? Well, there's a couple of things. We can try an intervention using an interventionist, but if any of you have ever had any addiction, and let's say smoking, for example, maybe you really like to smoke. How effective would it be for you if you really love to smoke and your family all got together and put you in the living room and said, you know, we really need you to quit smoking now. We all love you and we'll read you the letter. Well, first of all, you can't even get a heroin addict to sit there. We've had them in the hospital. They won't even stay hooked up to the IVs. They just pull them out and go out the door with blood squirting everywhere. They're bouncing off the walls. So we're way past that. If you could do that with a teenager, and we have done that, but first of all, the parents or the people who love them need to get education on how to deal with an addicted person. That's first. That's the very first thing. Because if you don't know how to deal with an addicted person, you're going to lose the game. Because it's a game. And every addicted mind works the same. Only the faces change. They say the same things. They do the same things. You have to know how to play the game. So go to an addiction counselor and learn how to play the game. And part of the game is that you have to play hardball like they're playing hardball out in the street. And that's the most difficult thing that we can do, is to tell our people that we love that, you know, if you want to use, but I'm not going to sit here and watch you die. So here's what I'm going to do. You either go voluntarily to treatment, or we're going to make you go involuntarily to treatment. And so we have a wonderful resource in Dickinson, and it's called the State's Attorney's Office. So all you have to do is go to the State's Attorney, Tom Henning, Jim Hope, and say, I have a loved one who's out of control. I'm scared for their life. I'm scared for us. We don't even dare let them in the house anymore. You file a petition for an involuntary commitment. They will call Badlands or me, and the person will have to come in for a drug and alcohol evaluation. If they don't show up for the alcohol and drug evaluation, we call the Dickinson PD or the Stark County Sheriff's Department, and they go find them. And they'll find them down at whatever hotel, or find them in a ditch someplace, or find them at a flop house someplace, but they'll find them, and they bring them to jail until the evaluator can then evaluate them. And now what happens? If the evaluator finds that it's a significant problem and they do need treatment, the first step is we take them to St. Joseph's Hospital, where they have to detox. And the detox process can take anywhere from 3 to 4 days if it's a serious opiate addiction. And then we arrange for, I'm sure Badlands does this as well as our agency, Sakakawea, but we arrange for treatment centers. And we use all kinds of treatment centers around the country for people, because we have different people who want more luxurious treatment centers and different people that can't afford anything and have no insurance, which we have to send to the North Dakota State Hospital. So that's kind of the process for that. We also have another process. Let's say, and I just had a guy like this here this last couple of weeks, got out of prison and hadn't used while he was in prison. And the reason he went to prison is because, well, you can't keep using without an income. So you get hooked up and you start selling it, and then you get caught. It's kind of funny how that works. So you go to prison, you don't use while you're in prison. You get out of prison, and then you can't wait to use again. And I don't know if any of you have ever been on a diet before, but I know I have. And I've been on the kind of diet where I thought it would be good to not eat really anything but maybe a little salad. Okay, so then when I got sick of that and went back off of my diet, I ate twice as much and put on twice as much weight, and I wished I had never gone on the diet. Well, that's the way that the heroin person, or any kind of an addict really, you get out of prison and you start rigging up. because that's what they did before they went. But they can't handle the amounts that they used to handle, but they think they can, and then they overdose, end up in the hospital, and then they come to us. So this particular person was good, really good. And when I say that, when a person is seriously addicted, they make lying an art form. You can't tell. I have been snowed so many times, I can't even believe it. But you can't tell them what they're saying is not true. This guy was good. He had an excuse for everything. So I said, okay, we have to wrap him up. Bring the family in. We're going to wrap you up so that you can't use. And here's what we're going to do. He said, well, I can't go to treatment. I got a job. I got to make a living. I got a car payment. I got to do all this. I can't go to treatment. I can stay sober. Okay, let's go with that. Let's go with that. So what we did is we developed a program that really works. And it was because of a lack of the kinds of programs that we didn't have in Dickinson, we developed this one. I will file a petition for involuntary commitment for outpatient treatment for you. All you have to do, and we go to court, and it's all free. Anytime you file a petition for involuntary commitment, it's all free to you. All you have to do is come in on Monday and Thursday. You'll take drug and alcohol tests. We do ETG alcohol tests, 80-hour alcohol tests. We do comprehensive laboratory-based tests. They're quite expensive, but we'll test for everything. We test for adulterants, and that is anything you can find on the internet to mask the fact that you're using. We test for adulterants. We test for flushing. So flushing is, in case some of you don't know, flushing is when you drink like a couple of gallons of water so that you keep it clear, and your specimen is dilute, and they can't see if there's anything positive in there. We test for synthetics, we test for steroids, everything. So Monday and Thursday you come in for these tests. Then you have to do individual counseling or group counseling. And many times we put them in a group, but sometimes in this particular case, it's dangerous to put him in a group because the level of where he was in his recovery, he couldn't really be with other users yet, not yet. So we put him into an individualized program. So if the person doesn't show up for their individual counseling sessions, and you can go 5 days a week if you want, if you need the support, and the 2 drug tests, I modify the commitment. We go back to court, and I tell the judge, can't stay sober on an outpatient basis, and the judge drops the gavel, and you're going to treatment. And then we find a place for them to go. It works really well, because think about it. Think about it for me. If somebody told me I couldn't have a chocolate chip cookie from now until forever, I think I'd have a real problem with that. And every chance I had, I would try to sneak it so that you wouldn't know. I'm pretty sure I'd do that. Okay, and if I didn't want to sneak it, well, I'd have to sneak it. But I have to justify in my mind why I could eat the cookie. And if I thought if I was just going to eat one, I could just eat one. And then I could talk myself into it. But if somebody had a commitment on me that said, I have to come in on Mondays and Thursdays in counseling sessions, and if I test positive for a chocolate chip cookie, I'm going to go to treatment, it really works well. And it really stops you from doing it because you don't want to go to treatment. So what we're doing is putting them in kind of treatment in their mind. We're making what we call a controlled environment. So that if you think about using, you're going to do something that you do not want to do, and you're not going to be able to stop it. Because that darn jam will do it to you. And so we play hardball with you. And then we teach the parents how to play hardball with you as well. Now this particular person, they get very good at lying. They get very good at manipulating. Every time he didn't show up, and just the greatest reason, I really couldn't go to the judge and say, yeah, he's not showing up, because he would just tell the judge, la, 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 and it sounded feasible. So what did I do? I tied him up at the beginning, but he didn't remember that I did. I said, do you think that you would sign consent so that I could speak to your parole officer just in case you can't stay sober? Because at the time, he really wanted to stay sober. And so he said, yeah, you do that. Do anything you can do. Well, we finally, I couldn't modify the amendment, but we contacted the parole officer. He knew what we were doing, and he's revoked, and he's back in prison now. He knew it. He knew this. We told him, but his addiction was so bad that he couldn't stop it. Does family love work? No, it doesn't. When he overdosed and his mom and his family were sitting at his bed, everybody's just bawling their head out. I walk in and the whole place is bawling. He's bawling, they're bawling. I almost lost my life. I can't believe I did this to my mother. I can't believe they're hugging. And he went back and did it again. He swore he wasn't gonna, but he did it again. Because it's over by 2000%. So there is treatment options that you can do. We do have resources here. And that's all I wanted to say as far as treatment. There is things that you can do. Run, don't walk to an addiction counselor. They can help you. They can help you get your person help. We can. There's also one other thing, one other program that I want to mention, and that's Suboxone. We have a Suboxone program. We have certified Suboxone doctors throughout the state. So let's say, and I had a client yesterday, 312 oxycodones a month were prescribed to her, and taking them. But this, heroin, oxycodone, Percocet, whatever you want to talk about with opiates, they do significant liver damage. So what we do is we say, how would you like to not take 12 oxycodone a day, but take 1 pill a day? And then it will take care of your pain, and it blocks the, oh, I feel so good thing. It actually helps you feel good without that high. And you slowly wean off over a year's time. It is a program that's run by the DEA, and while they're on the Suboxone program, they must be in counseling so that we can see if they're going to be not using it as prescribed, let's say that, okay? Works wonderfully. Everybody gets addicted to opiates. Everybody. Just have a surgery and see how well you like them. We all get addicted. So what we don't want to do is keep in that cycle. So Suboxone really works well. So that's another answer for what we can do with this. Okay, that's all I got.
All right, ladies and gentlemen, we'll bring our 3 speakers back up. Jan, David, Chief Dawson here. And if you have any questions, yes, sir.
There are currently 2.2 million people incarcerated in the system in the United States. Half those are in for nonviolent drug offenses, and there's a 65% recidivism rate, that's the rate at which individuals return to prison once they have been released. How effective of it do you believe criminalizing addiction and addictive behaviors is in deterring those individuals from utilizing something?
Well, I think to have a good drug program, it goes much more beyond just the drug enforcement end of it. I think you have to have a good system in place to try to wean those people off of the drugs, and get a place for them. Oftentimes, I don't agree that prison is also the best place for these people. It's not. Unfortunately, in society, we don't have a lot of choices right now. Jan had mentioned that we have a shortage of addiction centers, particularly in southwestern North Dakota. We don't have a lot of options here. in western North Dakota. I think actually we don't have anything west of the Missouri River, is that correct? Pretty much. We don't have an addiction center west of the Missouri River. And you take into account of some of the major cities in the Bakken, Williston, Dickinson, Minot.
Well, we have Badlands.
We have Badlands, but as far as a major addiction counseling center, we don't have that west of the Missouri River. And that poses a problem for western North Dakota.
Can you describe what your impression is of a major addiction center?
As far as the major addiction centers, where somebody can, a center that's got several beds. One problem we have in Dickinson is we don't have basically a detox center. We utilize St. Joseph's Hospital for that. We don't have a true detox center. And oftentimes these individuals then end up in the Southwest Multnomah County Correctional Center. And that's not an ideal place for them.
What, in my mind, what I would love to see happen, and I've talked to many legislature and city council people, and I've said, get me a building, is what I would like to see is tonight, if any one of you had somebody that needed treatment, needed detox, that you'd come to us. We put you in a detox bed. We have a nurse and a doctor on staff. You fully detox, and you move right into a treatment program that's in the same facility and it's integrated with mental health and medical. Now, Badlands is very close to that, except there is no detox. And so they end up either in the hospital, and the hospital is not a detox center, or the jail. And if any of you have ever had withdrawals from heroin, it's like you want to die. And so to detox in a jail cell is absolutely inhuman. And that's what we have right now. Unless Dr. Kylan says you can sit in a bed, that's what you've got.
And ladies and gentlemen, we're going to leave our panelists for discussion. We have cookies, juice, Gatorade. If you want to welcome to speak with them, stay and visit with us. Have any questions, or you want to talk to them on a private basis, we'll allow that. We're not going any place right away. So please stay and visit with us. I think I have an answer for you.